Hi, my name is Dominic. I'm going to be doing a quick ENT assessment today. I do not have a patient with me, although I'm going to bring up pictures to kind of guide my way to help you guys. Again, initially, when you walk into a patient's room, like always, you're going to do hand hygiene. You're going to introduce yourself. Hello, my name is Dominic. I'm going to do a quick ENT assessment on you. Is that okay? Of course, patient is going to agree. And then you want to make sure you have the right patient by looking at the two identifiers, the patient's name and date of birth. Once they verbalize that to you, you can go ahead and look at the wristband and confirm that. Okay, we are going to start by looking at the patient's eyes. So we have an eye here. We want to look at the physical characteristics of the eye. We want to see if there's any discharge, any discoloration, any redness. We want to pull the eyelids down to look for the color. Is it pale? That can indicate a sign of anemia. We want to look at the sclera. Is it discolored? Is it yellow? That can be signs of jaundice or liver failure. We also want to look at the size of the pupil. Is the pupil within normal range? Usually 2 to 3 millimeters is a normal size. When we have the pupils, we want to make sure they're reacting to light. You want to take your pen light. You want to bring your pen light in. The pupil will constrict when the pen light is shined there. And when you want to check both eyes should be reacting to that light. They should be constricting to that light. Every time that light is pointed near that pupil, it's going to constrict, let less light into there. Sorry. Alright, so after you check if their pupils are equally round and reactive to light, so you're comparing both eyes. You also want to make sure they are accommodating correctly. So for this, you want to take a pen. You want to move the pen light back and forth. You want to make sure those eyes are converging. When the closer they get to their face, they're going to become cross-eyed. So just right here, you'll be taking the pen, and the eyes should be crossing. Next, we're going to be looking at the patient's ear. Again, you want to start by visualizing and inspecting the ear before you lay your hands on it. Is there any drainage? Is there any discoloration? Any bruising? You want to see the backside of the ear. Is there any breakdown? Oftentimes patients are on oxygen and they're at risk for breakdown with the nasal cannula. You want to push on the tragus right here, and you want to pull on the auricle to see if there's any tenderness. That can often be a sign of an infection. Okay, after you go look at the ears and there's no tenderness, it's normal in position and appearance. This is a very normal looking ear. Next, we are going to look at a person's nose. A person's nose, we're going to be looking for patency with their turbinates. You're going to be looking in through their nose. Is their nose normal? Is it midline to their face? Is it symmetrical? You can also look to see if there's any lesions inside the nose as well as outside the nose. A lot of MRSAs like to live around mucosal openings, and the nose is really definitely one of them. And the following thing, we're going to be looking at the throat. Let's see here. 1 second. The throat. Here's a great picture. You're going to be looking at the throat, and you see the tonsils here. You see the tongue. Tongue is very moist. It's very pink. On a dehydrated patient, you would expect the tongue to be dry, the lips to be cracked, but here it's very moist, pink, good color. You also want to look at the teeth to see if they're in good repair. Maybe there's missing teeth, cracked teeth, crown teeth. But you're going to look at the gums to see if the gums have any breakdown or bleeding, any gingivitis. And then look at here. Make sure the uvula is midline, the tongue is sticking out midline. We have a little bit of tonsillar adenopathy here. We give it a Mallampati score of 2. If these tonsils were a little bit more swollen, we'd give it a 3. And if they're even touching that uvula or touching each other, we'd give it a grade 4. But in this patient, I would say it's a grade 2. We don't see any exudate, any pus, any discharge, any erythema or redness. We ask the patient to talk if they had normal voice. Any hoarseness of voice, that could be a sign of kind of like strep throat. If they have a cough, they might start to develop some irritation back there. Yeah, so those are the main things you're going to be wanting to look for. You could also ask about any um, objective or subjective data. Ask the patient if they have any changes in their vision or hearing, any changes in the way they taste the food. There can be also different signs that there's something wrong. Do they have any changes in their hearing? And that's all I have for you guys. Thank you.